Being a patient doesn't define me. I'm a Redskins fan. And a mom and a teacher. When I grew up here in Washington, I was born on the Marine Corps base, and I learned to be tough as a kid. And as a young mom, I did a lot of tough things. One summer, I spread 2 tons of concrete stucco on the outside of my house. And this is me with a 6-week-old baby and 2 other children under 5, backpacking in the mountains in California. So I was healthy and strong. And I woke up one morning 7 years ago with my toe joint so swollen I couldn't walk on my foot. Within a day, the other foot was the same. A couple weeks later, I woke up at 2 a.m. thinking I'd been shot in my shoulder. I had all 5 of those kids at home. I have a high tolerance for pain. This pain in my shoulder was like labor. 1 hour later, the other shoulder was the same. This continued, my knees, and then my ankles, and then my wrists. You get the idea. So somebody who could do 100 push-ups, I couldn't pull up the sheets, couldn't put the socks on my baby. You might think it's neat, I can't iron, right? I got on state-of-the-art treatment within a few months, but it continued to spread. Who knew there are joints in your vocal cords that can leave you silent, little joints here along your ribs that can make it hurt to breathe? Patients learn a lot of anatomy from this disease. But everybody offers you juice and Tylenol arthritis. One neighbor actually walked away shaking his head, you're too young to have that. And it doesn't seem like the doctors understand either. Every time I saw my rheumatologist, I would say, when can I run again? And she would say, soon you'll be running on the beach. But that didn't happen. So where do people turn when their life is upside down and nothing works and they can't get help and nobody gets it? Well, they go to the internet, and that's where I went. Twitter and Facebook, Blogger, where I started my blog. First I talked with dozens and then hundreds and then thousands of other patients. And I met people and read their experiences. At the same time, I was devouring journal articles and seeing what the medical profession was saying about this disease. And I still have people ask me every day what this woman's saying, what I asked back then, why is this so different from what we've been told it is? See, if you ask a patient, RA is a disease. It makes you ill. It causes disability, pain, and lots of health problems. But there's a false conception of RA that it's just a type of arthritis with occasional extra-articular symptoms, like coronary artery disease. It killed my grandfather. The prevalence with RA is twice that in the general population, and this is only one of many ways that RA affects the heart. And here's a partial list of ways that RA affects the body outside of the joints. Your veins, your eyes, your heart, your lungs. But I learned that only 60% of us show up positive for tests for inflammation, even when we have this disease activity, the tests CRP and SED rate. And yet this is what's used by rheumatologists to measure disease activity. And the other thing that's used so often by rheumatologists is external swelling. 96% of us in a very large study have inflammation that's detectable with ultrasound, and patients, believe me, know it's there, but the external swelling is not. And so the rheumatologist would judge these patients to be in remission. And unfortunately, not a large percentage of us have an excellent response to treatment. This is a typical clinical trial. We have about 1/3 non-responders to the treatments that are available. And we hear from the media to eat blueberries, that it's just a little morning stiffness. And we're sarcastically asked, why is your disease so expensive when it's so subtle you don't know if you really have it? And when the FDA is approving a new drug for the first time in a decade, a new kind of drug for RA, it's described as an inflammatory disorder that affects the small joints of the hands and feet. So here's a few shots from my website. This is how I've spent the last 4 years, working far more than full-time, talking to patients, trying to get good information, the most solid and current information, and bring that to patients. But at the same time, bring the patient experience back to the scientific and medical communities. Anne is one of the stories on my site. Her feet never swelled, but RA destroyed them. I have a few pictures, I have lots more, of the 6 surgeries she had on her feet. And after 20 years with the disease, she finally had a little swelling in her hands. You know, that's the main diagnostic criteria for RA, swelling in your hands. We asked 1,500 of our patients in our community whether they'd had swelling without damage or damage without swelling, because we started to realize we're not the only ones. We defined damage as bone erosion seen on X-ray or permanent deformity. You put these two together and you see that 3/4 of the patients in our community said that they'd had either damage without swelling or swelling without damage. And only 6% had the swelling and damage correlate perfectly. So we've come to recognize that the disease experience living with RA is distinct from what we call textbook RA, what's being considered in research and most clinical trials. We're told it's just a type of arthritis, that it mainly affects the hands, that when joints are affected, you can tell because they're red and swollen, that there are seldom systemic symptoms, and that patients tend to exaggerate that. Unfortunately, what we see is that patients minimize symptoms, hide symptoms, delay care, and the vast majority of them do experience systemic symptoms. So I wonder, would this be a really good idea? It was a dream come true for movies at first, right? What if we could go up like we get the blood pressure machine at the Publix and stick our arm in? What if they could take out a little blood and the CRP or the SED rate were good enough? And then they could tell us whether we were under control. I've also been a thyroid patient since I was 15, and I know that in endocrinology, this is kind of a struggle with patients, whether or not you can just measure the TSH and get your prescription and know whether you have enough. But we know what's obviously missing is the patient experience, the patient voice. So 2 years ago, we created the first nonprofit foundation in this country specifically for rheumatoid patients, where we're bringing the patient experience out of the box. We've done 2 surveys in the last 2 years as preliminary to more extensive studies and surveys that we're working on collaborating with Mayo Clinic and other institutions. But just to give you an idea of how motivated patients are to participate in making change, our last survey, we had 1,000 people answer that survey in the first 24 hours, 2,000 within 48 hours, and we cut it off on the 3rd day at 2,500. Over the last couple of years, we've created a couple of posters to present at the American College of Rheumatology in our exhibit, and the copy of both sides of this poster from that survey is in the handbook for the workshop. Of course, we did not discover patient-reported outcomes. This man on the left is a hero to me. He's Dr. Ted Pincus, kind of the godfather of patient-reported outcomes in RA. And he has worked for decades to prove that patient-reported outcomes are the most accurate predictor of disease outcome in RA, and yet these are seldom used to measure disease activity. And so patients ask me every day, why does my doctor say that I'm in remission because of my labs when my disease is so much worse. And I have to explain to them, no, there is no test that can show that. What test did they do? There isn't even an RA test to show that you have RA with a blood test. We have some inventive methods for imaging, such as a nuclear bone scan or musculoskeletal ultrasound, that are not widely used yet in this country because we do not have the machines and we don't have the training yet for that. And we know that we need better communication about evidence, but what the patients I know would like to tell you is that we need communication with patients that will create better evidence. This is a wonderful abstract I just found the other day from Tokyo, where they're rejecting evidence-based medicine in favor of evidence of their own patients that they will use to help their other patients. This is a clip, just a quick blip from our recent first ever Rheumatoid Awareness Day, just to show you that we also use social media for advocacy, but also and awareness. But take a quick peek at these numbers of almost 4 million impressions on Twitter, a 12-day campaign, our first ever press release, 250 comments in 1 hour on Facebook. These are motivated patients. They want to make an impact. They want change. People seek patient communities for information, but it's support that holds all that together. People run toward a patient community like this in social media because what they're being told and what they're reading does not make sense with their experience. And I'm not sure, I hope you can see it back there, even my hands swell sometimes. People don't want to be patients, people want to be healthy. But people who become patients need and deserve evidence that more reliably reflects their condition and that they can use to help make better decisions. And that kind of evidence only comes from participation with patients. Thank you.